Good morning. It's Wellness Wednesday, and it's going to be a different video this morning. So, I want to just first of all say thank you for always watching my videos and writing comments or making little comments during your appointments to me on what the videos mean. And I think this one is going to be a little bit more interactive because, like the title, it's going to be me being vulnerable about our family and giving you the perspective of being a spouse of someone who has been affected by COVID, as well as being a physician. And so that is what we're going to talk about today, and it might be a little bit longer video, so hang tight. So, yes, it's true. My husband is a survivor of COVID. We did not know about his illness until last week in the afternoon on July 1st. I'll remember the phone call now forever. And I will tell you that we weren't thinking it was going to be COVID. He started feeling sick almost 2 weeks ago, and we thought it was going to be some other items that were going on, and just happened to throw in a COVID test last Monday and on Wednesday. So it took 48 hours for us to get our test, and he has always been in quarantine. It was positive, but there was some interactions, and we were thinking, oh my goodness. My first thought was my kids and myself. And so I found a place, and just like you guys, the last 3 months, I've had a hard time finding some of my patients, some of the places to go get tested. So we were lucky enough to know where to go to get tested, my kids and I. And the first test was an antibody test, and that was negative. So we were happy about that. And that's what threw us off for a loop too. My husband's first antibody test was negative while we were waiting the 48 hours for the PCR test. And so that's the swab test. It's more accurate. And so my kids and I happened to go right afterwards. Our antibody test was negative, which gave me some relief. And then we watched and wait to see what would happen with the PCR results. But what did we do in the meantime? Well, I have put my family on some prophylactic remedies since the beginning, since March. And a lot of you are on that regimen because you've asked about it. And some of you right now might be going, wow, I might be thinking about it. So in the comments part, I will attach some websites and graphs that you can go to and see if it's something that you want to implement. There is a specific group, the A4M, Anti-Aging and Regenerative Medicine. They've been doing some incredible webinars, and I've been following those. And so that will be one of the links I will put in the comment section for those of you who want to go to it. So we did do some prophylactic items. We were doing prophylactic items, and I did increase them when we knew that my husband was positive. Some things like vitamin C and zinc, melatonin, it has been shown to help reduce cytokine storm. It's a great anti-inflammatory. Some of you are thinking, I thought it was just for sleep. So did I, until I did some of these newer webinars where I will tell you, I practice evidence-based medicine, and I love that there are articles that we can use with a specific aspect and formulation of things. So that's the key part, okay? Vitamin D, we had been on. Some of you have heard of me talking about activators. There's a specific pathway called the NRF2 pathway we've used. Increase in glutathione. Some of you might not have heard about glutathione. It's an incredible detoxifier, incredible antioxidant that our body, our liver makes glutathione, releases glutathione. You want to increase glutathione in your body. And that was one of the worries about using Tylenol, because Tylenol can decrease glutathione. So I'm not going to get too sciencey on you right now, but a lot of people have asked, what can I do and what did you do? So I wanted to throw those things out there, okay? What did I do specifically when my husband, we knew for sure we were fighting it? I went up on some of those doses. We added certain things. He did get short of breath. That was one of our worrisome symptoms. A full sentence was difficult to say. Walking to the bathroom made him winded. And so when there are severe symptoms, there's research now talking about using steroids. And I just want to say thank you to all my colleagues that helped me. I had a team of colleagues that, we would do research and we would decide on what my husband's treatment was going to be. And so, again, I can talk specifics with that. What we did when we went from prophylaxis to treatment, there are some things, because my entire goal was to keep him out of the hospital, because one, I wouldn't be involved. I hate that people are going through this alone, whether or not it's COVID. When you go into the hospital, your family cannot go. And that's a super scary thing, especially, I will tell you, I'll make it personally for me, because as a physician, I've always been the advocate for family and friends and gone into hospitals and help and be the translator between the medical advice and what needs to happen, and just being a bridge. And to know that I would be taken away and not be able to do that, I'll be honest, is super scary. The worst night was when he told me, like, which hospital will I go to tonight if my shortness of breath becomes too bad. Let me just tell you, I never thought I'd ever hear those words out of his mouth. That's how real this is, and how scary and true it became to my family. And that's when I was so thankful that I have a group of physicians here in Arizona that I could say, where do I take him tonight, or where do we go tonight? If there are going to be open beds, what does it look like? Who's going to greet him in the ER? That's the reality we're seeing here in Arizona. That's another reason why I wanted to share this. This is real. Wear your mask. We know that it's droplets, airborne. It's protecting you. It's protecting others. And so, yes, we talk about it mostly protecting others, but I think it's protecting yourself as well. So besides the hand sanitizer, washing your hands, and preparing your body to not be a host that this virus wants, there are other things that we can do. And so I wanted to come to you with just knowing these aspects. And you might be asking yourself, I have a function that I have to go to. What are things that I can do? Well, we talked about some of those prophylactic measures, but you can make it known when you go that, one, you're going to wear a mask. Two, you're not going to hug. I hated saying this to one of my friends today who has a wedding, but he's caring for his father. And guess what? I want him to be able to still be helping out. And so we talked about that, like actually making that announcement that, yes, I'm going to be wearing my mask. I'm not going to be shaking hands. I'm not going to be hugging, but I want to be a part of that event. So I think if you make decisions before you go to something that you really want to go to, I think you're going to be more prepared, and others are going to know what to do and where you stand as well. You can increase your prophylactic items that you're taking as well that day. You can come home, take a shower, change your clothes. I think that's really important to do on those days as well. Almost like we healthcare providers do what they do, when they come home, and how they greet their family, and whether or not they're with their family, and how long they quarantine. Those of you who don't know this, if you travel to Arizona, in some of the hot spots, they're asking you to quarantine for 14 days when you get back to your home. And so some of you that don't know that, that's how real this is. That's what a hot spot we are right now. And so those were some of the important things I wanted to go over. So what do you do if someone is positive in your home? We're lucky that we have a guest house. And so we were able to quarantine my husband. If you're unable to do that, I would say pick a room in the house that is their room, pick a bathroom that is their bathroom, and limit interaction. My husband wore a mask when we had to do certain things for him. I would say wear a mask to protect yourself as you're caring for that loved one. If you need to use gloves, if you don't know how to use them properly, don't use them. There's a right way to take them off. So you can talk to your healthcare providers or reach out to me if you're unsure, or watch a YouTube video. It's incredible on the correct way of taking off gloves. And so I would say it's got to be an area that's quarantined. The other area that I will tell you, I reached out to so many people, is how do you, come out of quarantine? And we're still dealing with that right now, because it used to be test-based, and it's not test-based anymore, it's symptom-based. And so we talk about, 10 days after symptoms started. We talk about and that goes after like the last fever. So the CDC has some guidelines with whether or not you test positive, whether or not you're symptomatic, and how to get back into socializing with family. And so we can walk through that too. But let me tell you guys, I wanted to pull my hair out. I read it every day because it's kind of like, okay, what does it mean? What day is day 1? What day is day 10? That's how real it became for me and how frustrating it became. And so for those of you who are feeling that frustration, what you have to do is you have to say, okay, I'm going to stop. What are the positives? What can I be grateful for? What can I do? That stops the negative spiral and going down the rabbit hole. And that's what I have done more than once during the day is go, what are the things that I can do? What are the things that I'm not sure about? And who is going to come alongside me and help me make these decisions? Don't do this by yourself. We tend to not do everything correctly when we're all by ourselves, right? So hopefully this has been helpful for you. I know that I just felt I wanted to get out and tell you what our struggle has been. It has become a personal struggle for us and our home. I'll honestly tell you, I didn't think it was going to hit the Rodarty household. We've done so many things with when we go to the grocery store, still wiping our things down, hand sanitizing, missing parties, so the fact that my husband contracted this and we don't know a clear source is reality of what we're dealing with. Arizona is a hot spot, and it's not to be fearful, it's to be prepared. Okay, so our family was prepared, and we're continuing to treat this in a serious manner and speak out about what you can do, how you can become a host that the virus doesn't want. That's how I'm taking this. I'm so thankful that my kids and I have not been positive. And I have to believe that we're not a host that this virus wants, but take it seriously. My husband's in his 40s. It's not supposed to do this to 40-year-olds. We're seeing the biggest number in 20 to 44-year-olds in Arizona. And so we used to think this was something for 65 and older. It's not. It's hitting all of us. It's a beast, and it doesn't care who it destroys in the process. So I would love for you guys to prepare your bodies to be as healthy as possible so that if it meets this virus, it can win. Okay, so again, I will put some resources in the comment section, and so that you can be prepared, because education is everything. Being prepared is everything. So this is not just the flu. Yes, a majority of people will get this and just do fine. But when you get it, it's not like the flu, and it deconditions you, and it can stick you in the hospital pretty fast. And so I want everybody to take it seriously. With that, I hope you do something today for yourself. Do some self-care. Maybe add one of the items that I'll put in those lists that you can prepare your body to be a host that this virus does not want. Okay, have a beautiful day. Bye-bye.